So, understanding antidepressants can be overwhelming due to the sheer number of options available. While these medications all aim to treat depression and related conditions, they work through vastly different chemical pathways. So, first arc number 1 focuses on two of the earliest classes of antidepressants developed, monoamine oxidase inhibitors and tricyclic antidepressants. So, for monoamine oxidase inhibitors, you can look at the gray enzyme illustration. These drugs work inside the neuron. They block the monoamine oxidase enzyme, which is responsible for breaking down neurotransmitters like serotonin and norepinephrine. By blocking the breakdown crew, more of these mood-regulating chemicals remain available. Just below them, there are tricyclic antidepressants, which are primarily block the reabsorption of serotonin and norepinephrine back into the neuron. Within TCAs, we further classify them based on that chemical structure, secondary amines like nortriptyline and tertiary amines such as amitriptyline and imipramine. Moving to the blue arch number 2, we find the most commonly prescribed class, selective serotonin reuptake inhibitors or SSRIs. If you look at the synapse illustration, typically neurotransmitters are released and then much is absorbed back into the sending neurons. The process called reuptake. SSRIs block only the serotonin reuptake channel. This increases the concentration of serotonin active in the synapse, which improves mood signaling between neurons. Because they are selective, they often cause fewer side effects than TCAs. This widely used group include citalopram, escitalopram, fluoxetine, paroxetine, and sertraline. The third arch in green represents serotonin norepinephrine reuptake inhibitors, or SNRIs. While SSRIs are selective to serotonin, SNRIs offer dual action. Look at the synapse illustration here. The green arrows demonstrate that these drugs block the reuptake channel for both serotonin and norepinephrine. By targeting two key neurotransmitters, SNRIs are a powerful tool, especially when pain symptoms are present alongside depression. The most famous drug here is duloxetine. Finally, the fourth arch covers atypical agents that don't fit neatly into the previous definitions. First, we have serotonin modulators like vilazodone. Below that, we have bupropion, which acts primarily on norepinephrine and dopamine, not serotonin. Then we have mirtazapine, which works on specific receptors to boost both serotonin and norepinephrine signals indirectly.